Okay, everyone, we're going to start live streaming at 2. It's about 1 minute from now. And so I'll give you the go ahead and then the 1AC can begin. And it looks good. Go ahead, 1AC.
Great. I already sent the document to all of you, so you should have it. And I will begin when everyone is ready. Good. All right. I will begin now. I affirm the resolution resolved, a public health emergency justifies limiting civil liberties. For sake of clarification, a public health emergency is defined by the World Health Organization as an imminent threat of illness caused by bioterrorism, epidemic or pandemic disease, or novel and highly fatal infectious agent that poses a substantial risk of a significant number of human fatalities or long-term disability. My value for this round is governmental legitimacy, defined by law as the right government possesses to impose binding duties on its subjects. My value criterion is upholding locke's social contract, or the idea that citizens conditionally consent to transfer some of their rights, i.e. life, liberty, and property, to the government to receive protections and benefits. Within our natural or inalienable rights are the civil liberties granted to citizens by the government, and thus, as citizens of a legitimate state, we give up some of these liberties. Contention 1, civil liberties are not absolute. Governments maintain the right to restrict civil liberties in specific instances. Regardless of the outcome, this government has a right for 3 reasons. First, harming other individuals is unjust. Respect for autonomy requires that individuals do not harm others, as it changes others' behavior permanently and irreversibly. Just as we restrict drunk driving because it poses a significant risk to other people, public health emergencies that can spread can harm others. And thus, the state retains the right to restrict people's liberty in order to prevent it from occurring. Second, individual liberty can be restricted for the public good. Locke explains that people in the state of nature conditionally transfer some of their rights to the government to better ensure the stable, comfortable enjoyments of their life, liberty, and property. The responsibility of the government is to promote the public good, and when it is proportionate and necessary to restrict liberties, they are justified in doing so. Take, for example, eminent domain, where in certain circumstances it is beneficial to expropriate private property for public use. Third, citizens have a right to public health. According to the WHO in 2017, health is one of the most fundamental rights of every human being without distinction of race, religion, political belief, or economic or social condition. Wilson 16 argues that health is its all-purpose enabler for any other number of other ends we might value at their own sake. He continues that the right to public health entails that individuals and communities have an entitlement that their governments systematically remove public health threats by taking appropriate measures. Liberty is not absolute. And given that public health emergencies threaten individuals, the public good, and public health, governments maintain the right to restrict civil liberties during them. Contention 2, upholding the social contract. Humans are prone to systematic errors in interpreting information in the world around them, affecting the decisions and judgments that they make. When making health-based decisions, there are 3 specific failures in cognitive perceptions that individuals have. But furthermore, a review of 9 countries across the course of the pandemic published 10 days ago revealed that country-level trust in science was the strongest predictor of compliance with public health policies. First is identifiable risk, or what Jenny 97 describes as the idea that humans respond far more aggressively to threats that involve those victims that can easily imagine as someone they care about. The wide reporting of statistical deaths rather than personal stories leads to disregarding of non-mandatory policies. Secondly, humans are present bias, meaning people tend to prefer immediate benefits to even larger gains in the future. Halpern 20 finds that this bias thinking specifically impacts health decisions. As a result, citizens are cognitively pressured to ignore voluntary measures for immediate benefits. Third is the tendency for people to overestimate the probability of low-risk events and underestimate high-probability risks, like becoming affected with the virus during a pandemic, also known as the representativeness heuristic. Due to these 3 cognitive biases when making health-based decisions, non-mandatory or voluntary mitigation efforts become ineffective. In Sweden, where COVID-19 lockdowns were not mandatory, death rate from the virus was nearly 5 times as high when comparing to its neighbors Denmark and Norway. As voluntary policies render ineffective, mandatory lockdowns are essential to stop dangerous public health emergencies. As a result, limitations in civil liberties during public health emergencies can be necessary for governments to uphold their obligations to protect life, liberty, and property. Subpoint A, mandatory lockdowns protect life. In only 3 months, Lebanon 20 found that approximately 500 million fewer people globally caught COVID-19 due to mandatory social distancing policies. Similarly, Sample 20 found that lockdowns reduce infection rates by 81%. CNN policy meta-analysis of 18 countries found that when lockdowns were lifted before scientific recommendation, higher death rates and prolonged impact occurred. There exists a clear scientific consensus that lockdowns protect far greater lives than voluntary measures, thus civil liberty restrictions protect life. Subpoint B, mandatory lockdowns protect liberty. And the short-term ability for governments to limit civil liberties protects against long-term authoritarianism. The International Monetary Fund predicts that a country's economic growth may take as much as 20 years to return to a pre-pandemic rate if they employ voluntary measures and fail to contain the virus. As these countries experience large economic crises, they are significantly more likely to experience democratic breakdowns, according to Gaserowski 98. Similarly, Surmat 19 finds that particularly in younger democracies, a strong correlation exists between financial crises and the beginning of authoritarian rule. Empirically, Muller 11 finds that authoritarian, non-democratic countries repress civil liberties on a larger scale than democratic states. Thus, to protect against democratic backsliding, governments must prevent economic failures as a result of a prolonged pandemic. Subpoint C, mandatory lockdowns protect property. John 20 finds that the economic price of inaction in the pandemic could be twice as high as a lockdown. By not restricting civil liberties and controlling the virus, my opponent pushes even more people into poverty. In contrast, the IMF found that the short-term economic costs of lockdowns could be compensated by stronger medium-term growth, leading to overall positive effects on the economy. Because of cognitive biases that affect decision-making during public health emergencies, voluntary actions fail. Thus, without mandatory restrictions of civil liberties, governments fail to protect life, liberty, and property of their citizens. Only in the affirmative world can the government protect people's most fundamental rights. Thus, I affirm and stand open for cross-examination.
All right, is everybody ready? Okay, then we can begin our time now. Okay, so what limitations on civil liberties are you upholding on the affirmative?
So you can look to my valid criterion where I talk about locked social contract and this idea that you give up some civil liberties to receive and back the protections and benefits of the government.
Yeah, which civil liberties on the app though?
I'm confused on the
specific. Are you wanting to limit?
Which specific civil liberties?
Yes.
Okay, well, if you can look to my majority of my second contention talks about this idea of lockdowns and as the lockdowns as a restriction on civil liberties.
Okay, so you're looking at limiting movement.
That's just one example of course there's others.
Okay, sure. So what are the other ones? Because is there like a line where the app draws where you say you can limit some, but for instance, you can't limit like freedom of expression or like freedom to have like a equal like trial under law? Is there like a line where you say, no, actually you shouldn't limit those ones?
Sure. So you need to look to my valid criterion to answer that question. It's if the government is obligated, if the government is completing its obligation to its people. So as I explained to you in my second contention, by short-term limiting civil liberties, you're protecting not only life, but liberty and property. So that's essential. That not only are you protecting life by limiting your civil liberties, but you're also protecting liberty in the long term and property.
What is the goal of a legitimate government?
To uphold my valid criterion.
But that is your value criterion. Right? Like
governmental legitimacy?
Well, what
that's
does
my value?
I'm just asking, that's your value. If that's your ultimate value, I'm just asking you, like, what does a legitimate government do? Like, why should we have a legitimate government? What's it?
Sure. Well, so I tell you, a legitimate government is one that is upholding its obligations to its people, and that's how you measure. Sorry.
What are those obligations?
To give its people the protections and benefits after they conditionally consent to giving up some of their life, liberty, and property.
All right. So what is the benefit of having negative reinforcement for people to follow the policies you're asking for? Because ultimately that's what limiting civil liberties looks like, is punishing people for not doing it. So what is the benefit of a punishment?
Well, first of all, it's not a punishment. It's actually like a saving grace. Essentially, I tell you in three ways in my first or my second contention, the three warrants that voluntary fails. But the benefit is I tell you in my second contention, life, liberty, and property. You have a right to continue living your life. You have a right to have more liberty and not to live under an authoritarian state, but you also have a right to better economy.
That's not my question though. Like, the way that you're having people change their behavior is negative reinforcement because you're implementing mandates like a lockdown and then you're punishing people for not following them. So what is the benefit of punishing people for not following the guidelines?
The benefit of punishing people to not follow the guidelines is that people follow the guidelines, and then you see all three of the benefits I list to you in my second contention. But also look at the fact that the negative isn't going to have the same compliance as I read to you the three warrants that say voluntary fails. So the negative is minus this punishment, but instead everyone doesn't have life, liberty, or property. I think it's much better that you have these consequences for not following mandates than actually losing your life, liberty, and property.
Okay. That was time. And I'm going to use running prep time starting Okay, that was 2 minutes and 16 seconds of prep used. Just gonna write that down. Is everybody ready?
Are you gonna send out a document?
Yeah, I'm gonna reply. I'll reply to that email right now with my doc. Okay. Oh shoot, sorry, I didn't reply all. Let me fix that. All right, just let me know when you receive that email and then I will get started.
I received it.
Okay. We're good? All right. Then I will begin my time now. I negate the resolution which states resolved a public health emergency justifies limiting civil liberties. As implied by the resolution, my value will be justice defined as giving each their due. My criterion will be consequentialism. According to Haynes in 2006, morality is all about producing the right kind of overall consequences. Overall consequences of an action means everything the action brings about, including the action itself. Since limiting civil liberties during a public health emergency produces significant negative consequences, it is not justified. There are other effective ways to manage public health emergencies that don't require the significant trade-off. Contention 1, policies limiting civil liberties come at a massive humanitarian cost. Rapucci 20, the COVID-19 pandemic has fueled a crisis for democracy around the world. The condition of democracy and human rights has grown worse in 80 countries. Governments have responded by engaging in abuses of power, silencing their critics, and weakening important institutions. Additionally, mandatory policies that limit civil liberties fail to account for people's circumstances. Cohen 20, the fear of human difference translates into the assumption that people have a home to shelter in, safety in domestic life, the ability to earn an income from that home. This presents people with an impossible choice: risk your life by going to work or risk your livelihood by staying home. Inevitably, this double bind intersects with other forms of intolerance. Subsequently, policies limiting civil liberties have pushed millions of people into poverty, meaning that they live on less than $1.90 a day. Robinson 21, the World Bank has estimated that 150 million people may have been pushed into extreme poverty during the pandemic. The charity UNICEF has explicitly linked this increase in poverty to the negative effects of lockdown policies. Because limiting civil liberties during a public health emergency results in unjust infringements on people's rights and increases global poverty tremendously, these measures are not justified. Contention 2, there are better ways to respond to public health emergencies that don't come at the expense of civil liberties. Government action to educate the public about public health guidance is an incredibly effective policy. Hong 20, we find a number of highly effective non-pharmaceutical interventions considered less costly. This includes government actions to educate and communicate with the public. All these measures are non-binding government advice. Communicating on the importance of social distancing has only been marginally less effective than imposing distancing measures by law. Government food programs and other support for vulnerable populations have also turned out to be highly effective. Such measures have a positive effect on public health, facilitating people's access to tests or allowing them to self-isolate without fear of losing their job or part of their salary may help reduce transmission rates. Inequality in the status quo makes it variably difficult to adhere to public health mandates. Government-sponsored programs empower people to follow public health guidance. Cohen 20. In BC, health officials recognize the key is not punishment, but social supports, such as food and medical care, that help people make the choice to stay home. Rather than deploying the police to enforce social distancing in public places, they focused on mitigating unintended consequences. Public health policies employed during the AIDS epidemic improved dramatically when officials moved away from limitations on civil liberties and pursued policies focused on education and support. Cam 20. During the AIDS epidemic, public health officials called for shutting down bathhouses and reporting the names of HIV positive people. Privacy concerns, fear of discrimination, laws prohibiting same-sex relations were hindering efforts to combat the disease. Public health officials developed a new approach through prioritizing HIV and AIDS education, building trust in communities, and encouraging voluntary condom usage. The protection of civil liberties was critical to the public health. The human rights-based approach makes voluntary public health policies more effective than mandates. Schmelz 21. Voluntary agreement is always higher than agreement under unforced measures for limiting contacts and vaccinations, or virtually identical for limiting travels and wearing masks. Control aversion, that is lower agreement under enforcement of voluntary conditions, occurs across all policies. Thus, average agreement is either higher under voluntary regulations or similar if enforced and if voluntary. Because public health policies that don't limit civil liberties are more effective and produce more trust in the long term, they should be favored. Now, moving on to my opponent's case, I agree with the definition of public health emergency. My opponent's value is government legitimacy, and I asked my opponent, why do you need a legitimate government? What does that government government do for you? Ultimately, the answer is that legitimate government is not where the values should stop. The government has to achieve justice. That's the ultimate goal. And in order to look at who's achieving justice, we have to consider how governments actually make decisions, and that's through a consequentialist lens. So looking at consequences is going to be the best way to determine the moral policy for governments to pursue. And then my opponent's criterion of Locke's social contract, first of all, nobody ever signs into this. It relies on this idea of tacit consent. But ultimately, the reason why it exists is so that citizens' rights can be protected by the government and that the common good can be protected as well. And the neg is achieving both of those better. And the only reason why there is like a government established in the first place is to maximize positive consequences for its citizens. Consequentialism is just a much better framework. Looking at my opponent's first contention, talking about how civil liberties are not absolute, my opponent says that you shouldn't allow people to harm others. But what we see is a policy my opponent is advocating for, specifically lockdowns, which is the only one that she specified during cross-examination, lead to significant harm for the most marginalized people in society who are pushed into extreme poverty like they were during the pandemic. And then my opponent says that you need to do things for the public good. Again, this is not being achieved, and it's not the necessary policy because we see that voluntary measures do work. Then my opponent says citizens have a right to health. Again, this is going to be better achieved on the neg, and there's a couple of reasons for that. So first of all, poverty has really big health impacts, and also it's a very long-lasting impact. So according to Karas in 21, half of the rise in poverty during the pandemic could be permanent. By 2030, the poverty numbers could still be higher than the baseline by 60 million people. That is a massive impact. And then additionally, this has really big health impacts on people. So that's according to Moakley in 21. Lockdowns fell hardest on low-income Americans and stand to push more people out of their homes. And then additionally, there's a lot of deaths occurring with homelessness. And most of them are not attributed to COVID-19. They're attributed to losing social supports because of lockdowns. So my opponent is going to say, you can have social supports in both worlds, but the reality is the policies my opponent is advocating for are exactly what remove the social supports for people. That's incredibly important. Now, looking at my opponent's second contention, talking about upholding the social contract, she's basically talking about how humans can't be trusted. But ultimately, if we want to increase compliance, which should be the goal, if we want people to like follow health lines to the best of their ability, we need to increase trust. And that's according to Bicchieri in 21, talking about how trust in government and trust in science are the most important factors here. But we achieve trust in science not through mandates that cause control aversion, but through education that I advocate for. And then additionally, according to Wiley in 2020, due to logistical constraints, even mandatory stay-at-home orders are dependent on widespread voluntary compliance to be successful. And compliance requires public acceptability and trust in government, which is eroded if restrictions are harshly enforced or maintained for long durations. And when we see, according to Robinson, in countries where authoritarian lockdown measures have been implemented, trust in government was eroded during 2020. So my opponent is eroding trust. This is the reason why there's lack of compliance. That's incredibly important in today's round as well. Then my opponent gives this example of Sweden. That's going to be important because we see that countries had really strict measures, actually had similar death rates to Sweden. So that's according to Camerlin in 2020. Sweden had similarly intermediate numbers of reported COVID-19 deaths and fewer per capita than Italy, Spain, and the United Kingdom. So clearly the answer here is that we need to actually increase trust and that these mandates are not actually what's helping. And again, that is the only policy my opponent actually upholds during cross-examination. And then in regards to protecting life, we see that there's a blowback when lockdowns are actually lifted, and that increases social activity. So again, another reason why they're not effective. In regards to protecting liberty and these economic impacts, the reason why there's bad economic impacts and poverty during a pandemic is because of lockdown policies. Again, the only policy that my opponent upholded during cross when I asked her, which ones are you upholding? And that doesn't even take into account all the other civil liberties that can be limited during a public health emergency that my opponent has to consider as consequences of that policy.
All righty, if everyone's ready for cross. Great. I will begin now. So who is the actor in the resolution?
Well, it doesn't necessarily specify an actor, but we can consider that because it's limiting civil liberties that the government would be the primary actor.
Great. All right. So what does the neg world look like? Are you advocating for voluntary lockdowns?
No, I'm not advocating for voluntary lockdowns. What I'm advocating for is increased reliable information and then also social supports for people, and not doing a lockdown, but giving people voluntary guidelines for how they could behave. Because what I proved during my case is that lockdowns themselves.
So voluntary lockdowns.
Sure. No, it's I'm trying to explain what because
it's not. Let's talk about your Huang card that talks about like non-pharmaceutical intervention. What is a non-pharmaceutical intervention?
Those are ways like to stop a public health emergency without using like a vaccine or medicine. And I would like to answer the last question because I'm not.
We're going to move on just really quick. Sorry, just for the sake of time, I have a couple other questions I want to get to.
Just gonna.
So real quick. So why is it not non-unique for social support? Why cannot the affirmative have social support as well?
So what we see, specifically in the card I read during my attack on your case in regards to like the Moakley card, that the reason why the lockdowns are causing so much poverty is because everybody draws into their house Now there's no more social workers. There's no more indoor places for homeless people to go. They're shut outside.
But if aren't they? Hold on. If we're doing, hold on, sorry, real quick. If they're doing voluntary lockdowns and you're saying that voluntary lockdowns have higher compliance, wouldn't everyone still be staying home?
I asked to clarify that and you wouldn't let me. I'm not advocating for.
Sure, no, we can move on to this. We can move on to the Schmelz 21 card about control aversion. So do you know how many people like Schmelz 21 like looked at to find this a conclusion?
I don't have a specific number, but I can.
You know what country they looked at?
Yes, so they looked at Germany, which is a country that has high levels of trust, and we still see control aversion in Germany. And so the way that we are going to maximize benefits is by not removing trust in government and certainly not removing trust in science. Sure. And also for the voluntary thing, I'm not advocating for lockdowns. I am advocating for other voluntary policies that people can follow if they are capable of doing so. Because some people are, if you're poor, if you're punishing them for it, then that's going to create really negative consequences.
Right. I understand that. So like if they're poor, like they still have to go to work.
I mean,
that's what you're saying?
It in some parts, yeah. They do
still. So then they go to work, they're more likely to get the virus underneath yours, correct?
Yeah, but they're also more likely to follow these policies that I'm advocating for.
How are they following them if they have to go still and go continue working? How are they able to stay home?
Because they can wear masks. And then they can also try to be distanced in other parts of their life. But the reality is some people actually do need to work and not have their businesses closed down because of lockdowns, because that is ultimately going to produce a whole other negative consequence. And I understand you're trying to solve a problem here, but creating a massive other problem is not the right solution.
Okay, that's time. So I will start running some prep right now. Already about 2:05 remaining. So brief off time, I'm going to go neg then af if everyone is ready. Perfect. I'm going to assume everyone is ready. I will begin now. So starting off on the value of justice and governmental legitimacy. Essentially, we are agreeing on the value here. We agree, my opponent concedes in cross-examination that the actor is the government, and in acting in a legitimate way, a government is in fact acting just. Therefore, we agree on the value. But the important part is the valid criterion. The reason you prefer social contract is because consequentialism essentially boils down to whoever saves most lives. I think we all can agree that a life is not worth living if you do not have things like civil liberties or other ways to make life worth living. And as such, you do not prefer her valid criterion, but I'll also get to that on the affirmative side of the flow. But moving on to my opponent's first contention here about, first right off the bat, my opponent reads this Freedom House 20 card that talks about like how democracy is going down in 80 countries. First of all, you prefer my subpoint B about this, like freedom going down, because her evidence is a survey of whether or not people in certain countries felt like they were taking their freedom away. That is what the Freedom House 20 card is using. So do not let my opponent use this evidence. But second of all, my opponent's second point here in this first contention is that we actually are pushing more people into poverty because of lockdowns. First of all, you cross my entire subpoint C here, which goes Cole conceded, by the way, the IMF card and both the John's 20 card, which tells you that in action, what my opponent is advocating for, voluntary lockdowns, do not work, first of all, and also that they push more people into poverty and more permanently into poverty. So right off the bat, but going on to the second contention here about these better ways of working. First of all, my opponent uses this Huang 20 card, but let me read you what also Hogg also tells you that, quote, that a suitable combination of NPIs is necessary to curb the spread of the virus. Hogg is actually advocating for at least some sort of civil liberty restrictions. Do not let my opponent use this card. Next, my opponent talks about HIV and social support. I grilled my opponent on this in cross-examination. My opponent cannot tell you why social support is incapable to occur in the affirmative. My opponent's only response is that people will still have to go to work, but that's if my opponent is actually looking for voluntary compliance in the negative world like she's advocating for, then she'd also want people to stay home. And in a voluntary world, there would be more people that need this social support, and therefore they'd be less available for those of the lower class and the homeless that my opponent is arguing that she's advocating for. But on the Schmelz 21 card, you prefer my evidence because, first of all, my opponent's card only looks at 4,800 people in one country in Germany. And second of all, it was a survey that asked if they would, in hindsight, follow voluntary. Not if they did, not if they will. But moving on to the affirmative side of the flow, right off the bat, we agree on the value, but on the valid criterion of social contract, my opponent says that no one signs into this, but that is how consent works. The conditionally consent, you receive the benefits, and as such, you give up some of these liberties. I cannot stop consenting just because I don't feel like paying my taxes, but I still also want to drive on roads that do not have potholes in them. That's not how government works. But moving on to my opponent's first contention, or my opponent's attacks my first contention here, right off the bat, my opponent essentially cross-played this idea that voluntary works. Let me remind you the card that I read that says 81% reduce in transmission because of lockdowns compared to voluntary. Right off the bat, you prefer that card because it's a meta-analysis of multiple countries. My opponent only gives you one example in Germany of 4,800 people that might have followed voluntary, not if they did. But moving on, my opponent cross-applies this idea of social supports. Again, this is a non-unique issue. This can happen in the affirmative. The only response to a public health emergency in the affirmative world is not just restricting civil liberties right off the bat. They can use social supports just as well. My opponent does not tell you why this is unique, and do not let my opponent come back up here and say that more people have to go to work. Moving on to the opponent's attacks on my second contention here, my opponent reads this idea of like you have to like keep trust to make sure that people will follow, but you actually turn this to the affirmative side because also that L20 tells you that in a study of 400,000 people across 15 countries, over 80% of respondents reported to being willing to sacrifice some of their own rights during a crisis. You actually see this public trust increasing, but you also turn this because the negative has no solvency, and as such, people will trust the government less if they do not provide for this. But moving on to my opponent's attacks on my subpoint A, B, and C, these are all just cross-applied. My opponent cross-applies this idea of like that we save more lives because of voluntary, but again, my opponent only gives two examples. One is Hogg, and the second is Schmelz, and both of which of their cards are completely false. But on Liberty, my opponent just cross-applies this democracy idea, but you prefer mine because it's meta-analysis, and my opponent Cole concedes my subpoint C about property, which is essential. For that reason, I strongly urge an affirmative ballot. Thank you.
Okay. I have 2 minutes and 44 seconds of prep time remaining, so I'm going to use that now. Okay. So yeah, just to clarify, after my last speech, I sent you the cards that I referenced, and I can do the same thing again. But is everybody ready for me to begin? Okay. All right. Then I will begin my time now. So I'm going to start off on the next side of the flow. My opponent basically says that we agree to framework, but essentially she's conceding my framework by saying, yeah, the reason you have a legitimate government is to maximize justice. Justice is going to be the value in today's round. And then looking at a criterion of consequentialism, my opponent says this boils down to saving lives, but no, it boils down to other consequences as well, like pushing people into extreme poverty. And also lives are a huge impact that I'm solving for within my second contention. And then my opponent says something really great for Beneg by saying, life is not going to be worth living with limitations on civil liberties if you don't have civil liberties, which is wonderful for me because I absolutely agree. We see what's happened when countries have limited civil liberties during public health emergencies, and it's resulted in the reduction of democracy in 80 countries around the world and people being pushed into extreme poverty. So I absolutely agree with my opponent there. Then my opponent says in response to my first contention that the Rapucci card is a survey. I don't understand why that's bad. It's asking the people living in that country what it's like to live in the country and asking them specific questions about factors that influence democracy. And it came to the conclusion that in 80 countries, it actually declined in democracy. So that's not bad evidence. It's coming directly from the people who are affected. And then my opponent goes on to respond to the poverty point, and just says to cross apply subpoint C and saying inaction leads to poverty. This, first of all, my opponent never provided any direct quotes from those cards. Additionally, my evidence links the increase in poverty during public health emergencies directly to the lockdowns. And you can see that evidence specifically because I actually have it carded within my case. And ultimately, we see that there was this massive increase in extreme poverty. The reason for that is because people's businesses closed. People couldn't work anymore. And again, those are the policies that my opponent is arguing for. So her point doesn't make logical sense. And I have evidence to support it where she didn't provide as much as I did. And then looking at this second contention, my opponent basically said that the hog card is actually advocating for a suitable combination. What the hog card says is, yes, the things that my opponent are advocating for, they are going to reduce transmission rates. It does say that. But the ultimate conclusion is what I said within my case, where it said that actually when you have education, when you have support, those are almost just as effective and you avoid the negative side effects. And it also mentions the side effects within the article. It says, according to Hog in 20, community mitigation measures have adverse consequences. School closure interrupts learning, can lead to poor nutrition, stress, social isolation, home confinement has strongly increased the rate of domestic violence in many countries with a huge impact on women and children, substantially limited the access to long-term care for chemotherapy, and with substantial impacts on patients' health and survival chance. And so governments need to look towards less stringent measures like the ones I'm advocating for. So that's perfect evidence for me. Then my opponent dropped the Cohen card talking about how punishment wasn't actually a good way to enforce these measures, which my opponent really has never answered for. Why do we actually have to punish people for not being able to follow mandates? And then looking at the CAM card, my opponent said this can occur in AF, but the whole point is that these social supports disappear when you have the lockdown. Again, the only policy my opponent actively advocated for during cross-examination. So no, you can't just have both, because having the social supports is basically just trying to make up for absolutely torpedoing people's lives and pushing them into extreme poverty after your policies are implemented. And then my opponent says in regards to Schmelz's part to prefer her evidence, and that this is only referring to one country. First of all, we see that control aversion exists in even countries that have high government trust, which is an important point. And then additionally, on the AF side of the flow, my opponent gives the perfect piece of evidence that actually provides evidence for more countries and more people actually being willing to follow these measures. And when she says and reads this card saying specifically that 80% of people around the globe essentially are willing to sacrifice their civil liberties for the public health emergency. And so that means that they would follow voluntary measures. So that card my opponent read in defense of her own case is actually extremely helpful to me. And it's proving the exact same thing that the Schmelz card proved, saying that citizens would be willing to do this regardless. And then moving on to the AF side of the flow, I already addressed that point clearly. But looking at this first contention, my opponent says that there's an 81% because of lockdowns. Again, lockdowns can be effective at reducing transmission rates. We also have to consider the effects of the lockdowns themselves, which is what I talk about within my first contention, especially when we see that there are other measures that would work just as well, which is what I talk about in my second contention. And then my opponent says social supports, makes the argument that you can have social supports in both. Again, I already addressed that. My opponent is getting rid of social supports for people by having lockdown policies, which is what happened in America. which is what led to people being shut out completely in the cold, not able to go into any places because they were all closed down. And then looking at my opponent's response to my attacks in the second contention, my opponent says, turn to AF, and then gives that 80% of people are actually willing to do it regardless. So again, that was a point where it's extremely helpful for me. And then in regards to the Sweden point that I made, where Sweden actually had just as the same like transmission rates as other countries with more stringent measures, completely dropped by my opponent. And then in regards to the second contention, or like the sub points talking about protecting life, again, it's clear to see that that's not actually what happens with these policies. And so ultimately, we're going to be seeing, first of all, we don't need to limit civil liberties because voluntary works just as well. My opponent proved that with her card saying 80% of people are willing to do these things regardless. And then I also proved it with the Schmelz card and the point about how in the AIDS epidemic, that was literally the only thing that worked. And then the next major voting issue is going to be looking at the terrible impacts of the policies my opponent is advocating for. So we see these within my first contention. There's the dramatic decrease in democracy around the world, which my opponent kind of brushes aside. This is a serious consequences of governments using a public health emergency to justify limiting their citizens' rights. That is a terrible consequence and has long-term impacts. And then we also see that for some people, complete lockdowns are not actually feasible. And that's directly punishing those people for not being able to follow those lockdowns in the Cohen card, which is very bad because it leads to all the negative impacts I talk about in the Robinson card in regards to 150 million people being pushed into extreme poverty because of lockdowns. And then again, my opponent also drops all of the arguments I make extending the impact of lockdowns on health and how this is going to last for 10 more years. And so all of those are dropped. Ultimately, we see we shouldn't do this under consequentialist framework, especially when we have other options.
Alrighty, if I could run the rest of my prep time, about 2:05 remaining, starting now. Alrighty. If everyone is ready, the order is going to be an overview on framework and then going down some key voting issues. If everyone is ready, sorry, I already asked that. Alrighty, let me get my timer up here and I will begin now. So first, starting off on the framework idea, essentially I went under either framework you use in today's round, and that's because something is justified if it's helping life, liberty, and property. But my opponent essentially concedes in the last round that we should be looking to life at the first, then liberty, then property. This is a pretty fair way to see if something is consequential. I win under either, and I'll get to that in my key voting issues. My first key voting issue in today's round is going to be the idea of lives. The negative does not give you a clear picture of what they're actually advocating for. Because first of all, I take down the Schmelz 21 card because it goes cold conceded when I tell you that it only surveyed 4,800 people. That should be not enough to mandate how we address the 7.1 billion in the rest of the world. And as such, if you don't buy that, the hog card actually tells you, my opponent had read what I was trying to say in the hog card. It says that in order to achieve the impacts my opponent is talking about, there has to be at least some non-pharmaceutical intervention. So therefore, my opponent does not have any offense to tell you why voluntary works, but I still do have defense telling you why voluntary does not. My three warrants go go cold conceded in today's round, talking about cognitive biases. My opponent does not address a single one of these warrants in today's round, and those go cold conceded. So you buy the fact that voluntary does not work, and as such, my opponent is advocating for a world with 5 times as many deaths. But if you don't buy that, you still flow through my cards that tell you that 500 million fewer people died as a result of restrictions of civil liberty. You buy the sample 20 card that tells you that lockdowns reduce infection rates by 81%. My opponent drops these cards, and as such, you flow the fact that the affirmative is the only one saving lives in the real life situation. But moving on to the second key voting issue in today's round, it's going to be the idea of liberty. My opponent's only offense here is this idea of freedom 20. But again, you prefer my cards, even if you buy what my opponent's card is saying, you prefer my cards, my long-term impacts, because they are empirical. They're telling you in a study conducted looking at historical trends, they've seen this. But again, you don't buy her evidence because it's talking about surveys. It's whether or not people felt like they were getting their democracy like was being hurt. It wasn't actually looking at democracy or governmental policy. But again, my opponent proves that my opponent drops essentially my subpoint B in my links here, telling you why liberty will in fact be restricted. My opponent does not tell you why. My third key voting issue in today's round is going to be the idea of property. This goes cold conceded in today's round. The idea that the International Monetary Fund tells you that the long-term impacts of a lockdown will actually be there will actually be positive long-term economic impacts. So every time, I'm not saying that lockdowns are not going to have short-term impacts on the economy. What I'm telling you is the long-term, it'll actually help. My opponent is advocating for a world of a perpetual state of pandemic because there is no solvency, as I've already given to you. The IMF also tells you that this is 20 years of this on the negative side compared to only a short term on the affirmative. But I also would like to ask my judges, what is my opponent advocating for? My opponent tells you that it's not feasible on the affirmative side to have people stay home, especially lower income people, and not feasible to have people lock down their businesses. So how is my opponent expecting in the negative world people to comply with this? My opponent is also telling you that people will not have to stay home or close their businesses. There is no solvency because only the affirmative protects life, liberty, and property. I strongly urge an affirmative ballot. Thank you.
Great debate.
That was really, really good. Thank you so much, judges.
Yeah, thank you.
Okay, so it looks like all the decisions are in now. This was a really great round. Great job to the both of you for making it this far. You go. It was a 2-1 decision for the neg. I voted on the neg.
Judge Zoe voted for the negative, code 830.
Yeah, I'm the one that's at.
Thank you, judges. And you did an amazing job. It was a really good debate.
Thank you so much, judges.
I'm sorry, were we able to stick around for feedback?
Yeah, I just thought like the live stream has to end first, right?
Mhm.